Hello again. Now, malaria season is upon us. Summer is here, and officials are urging travelers to take precautions in high-risk areas. Higher temperatures and consistent rainfall are some of the contributing factors to the widespread of this epidemic. Now, more than 7,000 cases have been reported in the country so far, and 66 people have been killed. That's according to the Department of Health. Let's talk more about this and the fight against malaria. I'm joined now by the CEO of Goodbye Malaria, Sherwin Charles. Sherwin, good afternoon. Welcome to today, and thank you very much for your time. Just the other day in Southern Africa, as you would know, they were marking Malaria Day here in SADC as part of global efforts to continue creating efforts about the fight against this killer disease. Are we winning the battle against malaria? You and I have spoken about this for quite some time over the last few years. And after the pandemic, where the focus was on COVID-19, are we now focusing again on malaria properly?
Hi, Dan. Thank you so much for having me on the show. Yes, we are focusing on malaria properly again. Of course, we are in a resource-constrained environment. And the resources that were available pre the pandemic are much less today for the fight against malaria. Our biggest challenge is that the progress that we've made since the early 2000s has stalled. And of course, since 2019, we've seen a plateau in getting to zero malaria. And so we are not on track at the moment to meet the SDG targets that were set for 2030.
Resource-wise, there are constraints, but in terms of what we're seeing on the ground, the government reporting some 66 deaths out to the end of October. That's quite a lot.
Yes, of course. We've seen an increase both in the number of cases and the number of deaths. A large percentage of the malaria that is recorded in South Africa, of course, is imported malaria. That is cases of malaria where the infection happened outside of our borders. And as you're aware of, and as we've spoken about, Goodbye Malaria actually is a regional effort to eliminate malaria, covering our neighbors on the eastern border.
So Mozambique still contributes quite a chunk, and Eswatini as well, to these numbers of imported malaria in the country?
Yeah, I think it's mostly Mozambique and Zimbabwe. Eswatini does not have many cases, and the cases seem to be clustered in certain low mountainous areas. But most of the cases definitely are coming from either Zimbabwe or Mozambique. Mozambique, of course, is within the top 5 countries who have the highest burden of disease when it comes to the number of cases.
Yeah, now, it is summer and traveling time is coming up. As soon as schools close and people go always, and as you've said, most of the cases that we've seen in the country of malaria have been imported, largely from Mozambique and Zimbabwe. From Goodbye Malaria perspective, what would you want people to note and do this summer as they begin to move around on holidays, including into Zimbabwe and Mozambique?
I really would like to encourage people just to be aware of the malaria risk in the areas that they will be visiting. Particularly, like you said, Zimbabwe and Mozambique. However, we have malaria, local transmission of malaria occurring in Limpopo, in Mpumalanga, and in northern KZN. So let's not ignore the challenge within our own borders. And so if you're traveling to an area that is considered a mild or slightly higher risk of malaria, please take the necessary precautions. Malaria is totally preventable and treatable and curable. So we're encouraging people to be aware of it. If it is a high-risk area, take a prophylaxis. If it's in lower-risk areas, be aware of using repellents, having long sleeves on. I know it's summer and that's difficult, but at dusk and dawn, ensure that you're wearing longer sleeved clothing.
What efforts are you as Goodbye Malaria involved with in places like Limpopo, Mpumalanga and KwaZulu-Natal provinces?
Because we're a cross-border initiative, what we've set up in Limpopo and Mpumalanga and northern KZN is mobile clinics. Our clinics patrol along the border. Where people tend to gather, we would test and treat people, and our mobile clinics carry both the diagnostics and the therapeutics with them. We also look to see where we find a sudden burst of cases in an area, and we send our mobile clinics out there. These clinics operate not at the official border posts, but along the border, all along our eastern border with the Kruger Park and the 3 provinces.
Okay. Finally, Sherwin, may I ask about the vaccine? I mean, a couple of years ago, when we spoke with you as Goodbye Malaria, there was a big talk around getting vaccines, and there will be trials being made. Where are we with that?
Yeah, we in a good space. In April this year, there was an announcement from the folk at Oxford University about a new vaccine that will be coming out and which is close to approval right now. This vaccine is more efficacious than the one we've had before. What we also see in terms of this vaccine, it's less doses to be given to children under the age of 5. And so as another tool in the toolbox, it's not a silver bullet, but it's certainly what we need right now to fight malaria. The 3 risks facing malaria have made it an incredibly high-risk disease at the moment. We've seen resistance to insecticide from the mosquitoes. We've seen drug resistance by the parasite in certain areas in Africa, which is very troubling. It's resistant to our current medication. And the third thing, Dan, is climate change. Climate change is creating havoc in the countries that are endemic. We've seen flooding, we've seen the introduction of new species, as well as high altitude areas, thanks to global warming, suddenly experiencing malaria where previously it was too cold for mosquitoes to survive.
Yeah, the impact of climate change is still untold and still not fully understood, and it will affect so many other initiatives. Thank you very much for your time and insights and advice as well, Sherwin Charles, the CEO of Goodbye Malaria.